Okay, so yep, today we're starting with 9.4, the role of parents in achieving optimal prenatal development. So optimal prenatal development means the best possible development for your growing child. So the learning intention and success criteria is we're going to understand the role of parents in achieving optimal prenatal development. You should be able to explain how parents can actually influence their child's development in the womb, as well as when the child is born. So prenatal is pre, meaning before they're born. Antenatal is after. So after they're born, how can they continue to look after that child in the best way possible? So we're specifically going to look at a few different things. The first thing that we're looking at is maternal diet. So what is the role of the mother's diet in terms of what they eat? How can that affect the child? And we're going to look at 3 specific nutrients, which we did cover in chapter 4 as well, which are folate, iodine, and iron. And we're going to look at why are these important for the growing baby. And then we're going to look at what is the impact of some harmful behaviors that can actually negatively affect the growing baby in the womb. So if the mother drinks alcohol, how can that affect? If the mother or the father smokes, how can that affect? Because obviously babies don't have to, the mother doesn't have to be the only one smoking in order for the baby to be affected. Mothers can take in passive smoke from someone else who smokes inside the home. So that's important to remember. Yep, tobacco smoke in the home, as well as examples of food. So I kind of talked about this a little bit last time when I said that there are certain foods that pregnant women should avoid. For example, like Macca's soft serve is something that a lot of people don't know can actually be harmful for pregnant women. Okay, so this is just some examples that we're going to look at today. So moving on to the actual topic. So when we're talking about the role of parents on prenatal development and antenatal care, like I just said before, prenatal development is essentially before the baby is born. So while the baby is still in the womb or in the mum's tummy, it's before they're born. Okay, and antenatal, A for anti, A for after. Okay, so after the baby's born, we cannot provide them with prenatal care because now they're actually born, they're actually in the world, so now we're providing them with antenatal care. So it's important for parents or carers, as well as the community, to understand the risk and protective factors that are going to influence the optimal development of a fetus during the prenatal stage. Why is it important for the community as well? Well, if you think about it, if you're someone who smokes and you go to sit on a bench and smoke, and the person next to you is holding a newborn baby, you should have enough common sense and knowledge, health knowledge at least, to understand that smoking next to this newborn baby is a bad thing. And so it's not just the parents who have to put an effort there, but everyone around them as well, to make sure that that baby is kept safe and out of harm's way. It's important for parents to also have access to antenatal care. So antenatal care is basically things like maternal health nurses. You've got other kinds of nurses that can also help. You've got health clinics. You've got health resources, you've got like doctors who will have in-home visits to basically look after the child and to give the parents tips. Okay, all that stuff is important because it's not just, the more scary part isn't just when the baby's in the mum's tummy, but it's also more scary when the baby's actually out in the world and now exposed to actual real threats and real dangers. So antenatal care is important so we can continue to monitor the health and well-being of the baby. So, if the baby's, height is kind of growing properly, if the baby has any skin conditions that pop up or has any weird rashes that kind of appear on the skin, all that kind of stuff. Even something like, is the baby vomiting for some reason? Is the baby not drinking enough milk? Is the baby not breathing properly or making weird noises and feeling like it's not, breathing in the correct way when it goes to sleep? All of that stuff can actually really cause a lot of worry and stress for new parents. So having access to an antenatal care resource like a maternal health nurse or a doctor is extremely important to kind of give these parents a peace of mind that their baby is okay. And if the baby is not okay, then that's fine, but we have to make sure we can provide the medical interventions to make the baby back to a state that is good and safe and healthy. So that's the role of parents on prenatal development. Prenatal meaning before born, so before birth means the baby's in the tummy. Antenatal care is after the baby's born. How can we then continue to care for that baby in the best way? So the first thing we're looking at is maternal diet. Now, maternal diet is an important influence on the child's development, especially when they're in the womb. So when they're still in the mum's tummy, it's important in general for a mother to have a healthy diet. The mother can't just be eating junk every day. They do need to eat a healthy diet. But in general, there are specific nutrients that are more important than others for pregnant women. And a lot of the time, if you've ever gone shopping or if you've gone to like a pharmacy or chemist and you've just kind of looked at the different types of vitamins there, you might notice that they've actually got specific vitamins for pregnancy specifically, okay? And these vitamin bottles actually have multivitamins in them that have a higher amounts of folate, iron, and iodine, okay? This doesn't mean that mothers have to take a multivitamin. They can obviously get these nutrients from food, but a lot of the time, you know, if you've ever been around someone who is pregnant, or, you know, when your own mothers were pregnant, you would obviously realize that a lot of the time pregnancy can lead to vomiting a lot. It can be hard to actually keep food down. So sometimes multivitamins are important to make sure that the mother's getting all the nutrients they need. Now, a lack of folate is found in a lot of our green leafy vegetables. It's found in things like spinach and that kind of stuff. And if you don't have enough folate when you're actually pregnant, your baby's spinal cord and basically that neural tube actually doesn't develop properly. And what actually happens is that the spinal cord doesn't develop in a way that's nice and strong and straight. It actually starts to develop in a kind of crooked or bent way. And what that essentially means is that the baby's kind of going to be born with kind of like a hunchback appearance. And that's something that they're not going to be able to fix with posture exercises or that kind of stuff. So spina bifida is the name that we give to neural tube defects, and neural tube defects are the #1 health condition that can arise in babies as a result of not having enough folate or folic acid in their diet. Okay, so how can mothers basically prevent this? Well, they can obtain folate from food or from a multivitamin. Okay, usually having it through food is better because you're again going to be able to get more nutrients from that particular food you're eating. So if you're eating spinach, for example, you're not only going to have the folate coming from the spinach, but also the fiber coming from the spinach, okay? Also the vitamin K coming from the spinach. You've got all these other nutrients in them. Okay, so folate can come from various things. So you've got vegetables, you've got chicken, you've got eggs. All these things contain a really good source of folate. Also, because folate is a nutrient that is deficient in a lot of the population, the government actually has a lot of folate fortified food. So if you ever look to the back of your cereal box, you'll realize that there is folate in your cereal. Okay, it doesn't occur naturally, but the government supplements cereals and breads and pastas, a lot of these different products with folate. So they essentially enrich these foods with this nutrient during manufacturing processes. Okay, so that is basically folate. Folate is important for the proper and correct and, you know, straight coordinated development of that spinal cord. And if you do not have enough folate, your baby is going to end up having a neural tube defect, which means that it actually leads to the spinal nerves protruding, and that essentially will make them have a crooked kind of crooked spine, which will essentially lead to a hunchback-like appearance. Okay, so that's the effect of folate. So the next nutrient that we look at that is important for pregnant women is iodine. So iodine.
I've always wondered, you know how like when a woman's pregnant with the baby, baby back is like all like, it's not in a straight position. It's very like crooked.
Yeah, so that's essentially like when the baby, in the beginning, that's how the baby is positioned, but as the baby approaches or comes to the end of the fetal stage of development, it actually positions itself in a head down position, which means that it's ready to now travel through the birth canal to come out into the world. So it's like at the beginning, it's kind of positioned in a very awkward way, but as it goes through those 3 stages of prenatal development and essentially towards the very end of the fetal stage, it will actually position itself in a head down position. So it's ready to come out.
So like the back becomes like positioned properly.
Yes, correct. Yeah.
All right.
Yeah. So the next nutrient that we look at is called iodine. So iodine is also very, very important for pregnant women to have. So iodine is a mineral, and iodine is important because it actually promotes really good brain and nervous system development. And because you're obviously, because the mother needs a good amount of iodine in her diet, she needs to take extra iodine for the baby as well, because there's this famous saying that, when you're pregnant, you have to eat for 2 people, but that's not actually true. You don't actually have to eat for 2 people, but certain nutrients, you've kind of got to have maybe double or a slightly higher quantity. Okay. And iodine is one example of that. So essentially what happens with iodine is that it is important for the brain and nervous system to develop properly. Now, if the mother experiences iodine deficiency during pregnancy, this means her baby is at a higher risk of not growing properly, okay? Because obviously when your brain and nervous system are not developed properly, the release of certain hormones, for example, the growth hormone, are not going to happen at the correct times. So stunted growth can actually be one impact of being iodine deficient. Another impact can actually be intellectual disability. So intellectual disability means that you're at an increased risk of developing like learning deficits. You're at an increased risk of developing conditions like dyslexia or Down syndrome, those kinds of intellectual disabilities. Now, as Australia doesn't have a sufficient iodine concentration in the soil, what actually happens is that we can't actually get iodine from eating crops out of the soil. So in some countries where there's a lot of iodine in the soil, when your crops or your potatoes or your carrots are growing in that soil, they kind of absorb that iodine. In Australia, we don't have really good iodine in the soil. So what happens is that a lot of our salt is actually supplemented or enriched with iodine. So iodine is actually added to specific types of salt in Australia, and it's actually also added to all commercially sold bread. So the bread that you find in Coles, packaged, all that stuff, that all has iodine salt. Okay, iodine salt is used to make those breads. So iodine.
It means like too much salt is not like good for you.
Yes, so if you are going to take salt, obviously it's better for you to take iodized salt, which has added iodine in it, compared to just plain old white table salt. So that's essentially the idea. Now, obviously, iodine, exactly like you said, too much salt is not good for you. So there are other food sources that we can actually have to get our iodine from. Okay, and women who are basically pregnant, who are trying to increase their iodine intake, they can actually get iodine from fish. A lot of your seafood products have a good source of iodine. So fish, seaweed, prawns, squid, all of those things are very high in iodine. On top of this, if you're not much into seafood, or you're pregnant and you've got kind of an aversion towards seafood, you can't stand the sight of it or the smell of it, you can go for eggs, even something like milk. Okay, strawberries are a very good source of iodine. So you've got a number of options there that you can actually have, and some of them are shown in this image here as well, as you can see. Okay, these are actually, in case you're wondering, these are prunes. Okay, prunes are dried plums. Dried plums are a very high source of iodine. So just some examples there on the slide. Probably just know at least 2 examples of food sources. Okay, so it's important for us to remember that iodine is important for the development of the brain and the nervous system, okay, in babies. And that obviously you want your child to have the best possible development, without having any stunted growth or, delays in their growth. So iodine is very important for mothers to have in their diet when they're pregnant. And the next nutrient that is important for mothers to have is iron. Now, we've looked at iron a lot in Unit 1 when we talked about nutrients, that tend to be quite low in women. Obviously, when you're pregnant, you are at a higher risk of iron deficiency. And essentially what happens is, because you're a woman, already you're at a higher risk of being deficient in iron. But when you're pregnant, because your baby is kind of, because the embryo of your baby that's in you is, requiring oxygen, and that oxygen is being supplied to them through the placenta, what that actually means is that you need extra iron so that you can have some going towards your baby and some for yourself. So iron is required more because of that increased demand for oxygen, okay, for both the baby and for the mother as well. Now, during pregnancy, there is an increase in blood volume for the developing baby. And obviously the mother's reproductive organs also start to get bigger in order to prepare for pregnancy and all that stuff. So this component of hemoglobin, as we know, hemoglobin is a component of your red blood cells that do carry the oxygen around your body. So obviously, in order to allow that proper amount of energy to be present in the mother, in order to ensure that the mother is not fatigued or anemic or completely exhausted during pregnancy, we need to have more iron, iron intake, okay, during pregnancy. Now, pregnant women can actually get good sources of iron. Now, the best source that most of us know is red meat. Okay, we talked about red meat being very high in something that we call heme iron. Heme iron is actually very absorbable. It's like very well absorbed by the body. Okay, it's something our bodies like take straight away. If you're a vegetarian, it's not a big issue. You can still get iron from foods like fruits or nuts. Green leafy vegetables like spinach and broccoli, all that stuff. But that iron is not as well absorbed by the body. So you might have to eat more of those foods compared to how much red meat that you actually consume. Okay, so again, being a vegetarian doesn't really put you, or being a vegan doesn't really put you in a good state in terms of iron absorption, but it isn't impossible to now get iron absorption. And a lot of these new kind of vegetarian sausages or vegetarian mince that they make, that actually they kind of supplement that with iron as well. So it's kind of enriched into the product. Okay, a lot of milks as well nowadays actually contain iron in them too, again, just enriched or supplemented during the manufacturing process. Now, high fiber diets, alcohol and tannic acid is what you find in tea that gives tea its kind of tan color, can interfere with iron absorption. So if you're someone who drinks a lot of tea, if you're someone who drinks a lot of tea, or you eat a lot of fiber in your diet, those are good things. Tea and high fiber diets are good things, but they can actually interfere with your iron absorption. And so if you develop iron deficiency anemia during pregnancy, like I said before, it's not a good thing, because pregnant women are already exhausted carrying this baby in them. And iron deficiency anemia just makes them more and more fatigued and more unable to do the things that they need to do. Okay, so iron deficiency anemia also, in more serious complications, can actually lead to premature birth or low birth weight babies. So essentially, those are the more serious complications. But most pregnant women, especially in countries like Australia, where we have proper healthcare systems, where we are monitoring the mother from day one, the chance of you actually developing iron deficiency is quite low, okay? Especially when you're pregnant, people, everyone around you, the community, gives you extra food, gives you extra tips. And so the chances of you being malnourished during pregnancy are quite low. Okay, so remember the main 3 nutrients that you need to know that are important for maternal diet for pregnant women are iron, iodine, and folate. Okay, so you need to know what those 3 are, what effect they have on the mother and baby, and what happens when we don't have enough of them. So what happens to the baby, and just 2 examples of food sources for each one. Okay, so what are some foods that pregnant women should avoid? And some of you would already know this, okay? A lot of the time, it's kind of common sense knowledge. Now, remember that what the mother eats directly affects the baby, because the baby receives all those nutrients, all that nutrition, all the energy through the placenta. The placenta is kind of that little pouch that allows for the exchange of substances between the mother and the baby. Now, maternal diet can be a risk factor for the fetus if the mother is to consume foods that are that do contain certain types of bacteria or that are harmful for the baby. Okay, so there's a specific type of bacteria called listeria. Now, listeria, there are also other types of bacteria like E. coli, salmonella, all of those are different types. But listeria specifically is a really dangerous type of bacteria which can actually increase the risk of miscarriage, stillbirth, and premature labor risk because of its ability to actually infiltrate the placenta and actually affect the baby directly. Okay, now for this reason, there are certain foods that mothers should avoid. These foods don't always have listeria in them, but at certain temperatures, at certain, in most cases, they do have listeria. Okay, and so for that reason, a lot of these foods are not dangerous for us as normal people, but for pregnant women, they're actually quite dangerous. Okay, so pregnant women, it's always better to be safe than sorry. So these are the foods that they should avoid, and I want you guys to know at least 2 examples of these foods. The first one is soft serve ice cream, such as the ice cream you find in Macca's. Okay, this doesn't include ice cream that you just scoop out of a tub. Unpasteurized foods. Unpasteurized foods are like raw milk, for example, the milk that you get fresh out of a cow's udder. Okay, the milk that you buy at the shops is obviously pasteurized, so that's fine. Soft cheeses, so there's really soft cheeses that you see on those cheese platters, such as camembert, brie, ricotta, all that stuff. Unless you cook them and they're served hot, that's a different story, like in a pastry or something. But if you're eating them raw, the bacteria is still there. Pre-cooked or prepared cold foods, okay, quiches, some types of, foods that are eaten cold. Delicatessen meats like salamis and stuff can also be affected. Salad from buffets, especially if that salad has been kept out for a long period of time, it's more likely to develop that listeria in it. Raw seafood, so this is a lot of the reason why pregnant women often avoid things like sushi. They don't go to sushi bars or have sushi in general, because raw seafood can actually have listeria in it. Okay, so essentially those are some examples of foods that pregnant women should avoid. In most cases, foods that are well cooked and eaten straight away, served hot, are not a problem. Okay, it's just foods that have been lying on the counter for a long period of time, like foods you might find in a buffet. Also, in addition to this, foods that contain high levels of mercury can put the baby at risk as well. And it's very, very important to be careful, because certain types of, it's not so much nowadays, but in the past, certain types of canned fish actually had high levels of mercury. And depending on where you were buying your fish from, what kind of fishing was used, was it responsible farming of fish, or was it unethical farming, that could actually affect how much mercury was in the fish. Okay, nowadays, especially with what's on our shelves here in Australia, it's not a big issue, but this was more of an issue in the past. Now, obviously, because of this whole debate about high levels of mercury in certain types of fish, women do need to be selective about what type of fish they consume. So certain types of fish, for example, shark, barramundi, southern bluefin tuna, all of these should be avoided during pregnancy because they are quite high in terms of their mercury. Okay, so essentially those are the types of fish that you should be avoiding. Okay, now the last 2 slides that we're going through are just looking at parental smoking and tobacco smoke in the home. So smoking during pregnancy is a significant risk factor. We all know this, okay, it's just common sense that smoking is bad for you, for your baby. Now, the reason that exposure to tobacco smoke is dangerous is, remember before I was talking about the fact that the baby is held in a little pouch, like it's called a placenta. And that placenta allows for the exchange of substances, not just food, not just nutrients from food, any substance that the mother takes in, whether that's tobacco through a cigarette, whether that's an actual illegal drug, whatever it is, whether it's alcohol, whatever bad thing comes out of that substance that the mother is consuming or taking in, the baby is directly affected by that. And for smoking, specifically, we know that cigarettes contain thousands of chemicals, ranging from paint thinner to tar that you find on the road. Okay, so many bad chemicals in there, which actually suffocate the baby by reducing that oxygen flow. And so essentially the baby not only is exposed to these dangerous chemicals, and that does not only affect their development badly, but it actually literally suffocates them, okay? In the same way you can't stay in a room with someone who's smoking and the room is getting filled with cigarette smoke, how do you think the baby's going to cope with that? So specific risks to the baby include, and I'm only going to ask you guys to learn 2 again. So just any 2 of these specific risks. So babies whose mothers smoke and who are exposed to that smoke while in the placenta are likely to have a low birth weight. Spontaneous abortion, which means that sometimes they can actually be aborted early because of those complications. Premature birth, so that means the baby does deliver to partial term, but not the full term. Complications of the placenta, so again, the placenta becomes a really kind of suffocating place to be in for the baby. Birth defects, lung function, issues with, ability to breathe, okay, issues with even respiratory conditions that occur after the baby comes out, so asthma, all that kind of stuff. And it also increases the risk of infant mortality. So even if the mother doesn't smoke herself, like I said at the beginning, if the father smokes or one of the older kids in the house smokes, even exposure to secondhand smoking can actually still be bad for the baby, because the mother is still inhaling that smoke. Whether it's directly that she's doing it or indirectly through passive smoking, it's still going to harm the baby in a bad way. So it's important to remember that, yeah, these are the specific risks involved with smoking, and that it's not just direct smoking that can be an impact, but also passive smoking. So one thing that these couples can actually do when they know that the baby's on the way is they can negotiate. So if this lady doesn't smoke, but her husband smokes, well, they have to discuss together and say, okay, you've got to give up smoking for 9 months, or if you want to have a smoke, you've got to drive down the street, have the smoke and come back, because we can't have this tobacco smoke in the house. Okay, so that's something parents have to negotiate to promote the best antenatal care and prenatal care for their child. And the last thing that we're looking at today is alcohol use. So we know that alcohol consumption during pregnancy is the worst thing that you could do for your baby. Alcohol can cause problems for women even before pregnancy. So women who drink high amounts of alcohol each week, it's actually harder for them to become pregnant in the first place. And they have a lot of issues with things like infertility, which is the inability of a person to get pregnant. Okay, so women who are trying to fall pregnant need to stop their consumption of alcohol altogether. Now, when alcohol is consumed by a pregnant woman, like we said before, the placenta is a pouch that allows for the exchange of substances. Alcohol is one type of substance. So when alcohol crosses the placenta from the mother's blood into the baby's blood, it can actually directly affect the baby. And so if you look at this picture here on the right-hand side, this is actually a picture of a child whose mother, while she was still in the womb, consumed high amounts of alcohol. And so when this baby was born, some of the baby's features resembled something that we see in kids who have fetal alcohol syndrome, which is, while they were a fetus, they actually had this alcohol syndrome because of the high amounts of alcohol that the mother consumed. And so you can see that there are certain features here characteristic of kids who have fetal alcohol syndrome, some of which are a short nose, a smooth philtrum. The philtrum is the part of your skin directly above your lip. Okay, usually people have a ridge around here. This girl doesn't. A very thin upper lip and short palpebral fissure length. That's not very important, but yeah, these are just some. You can tell that this girl's face looks like it. You know, there are certain parts of it that have been affected by that fetal alcohol syndrome. And there are some more examples in the picture underneath. So underdeveloped jaw, flat cheeks, okay, cheeks that are not full, very small head because of obviously the brain development that's been impacted as a result of the alcohol exposure, all that stuff. Now, a fetus that is severely affected by fetal alcohol syndrome is at risk of dying before birth. So this girl, when she was in the womb, she was at a higher risk of actually dying before full-term delivery compared to a child whose mother did not smoke at all. And the problem with alcohol is that it directly affects the development of your nervous system, including your brain, which is why these kids' heads actually remain small, because the brain doesn't develop to its full size. And obviously, because of that, the head doesn't kind of develop in proportion to the brain. Okay, so another problem with alcohol use is that, similar to smoking, with the fact that smoking suffocates the baby in the placenta, the use of alcohol can also narrow the blood vessels in the placenta. So it can actually restrict the blood supply to the fetus. So the amount of oxygen that the baby actually is exposed to, or oxygen that they have available, is restricted as well. Okay, so that is some of the impacts that we see with mothers who drink alcohol and how it affects their babies in the womb. So you just know at least 2 examples of how it affects the babies if the mother drinks alcohol. Right, and that's about it for today. So I'll just stop the recording here.